Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
Global Goals Week is a shared commitment of partnership between civil society, business, academia and the UN system to push action on the Sustainable Development Goals. The 17 goals were put in place as a guide to achieve a better and more sustainable future for all. They address the global challenges we face, including poverty, inequality, climate change, environmental degradation, peace and justice, bringing us to learn more about them and move us towards taking action.
But also you have to understand that the Sustainable Development Goals, they guide the allocation of funds and human resource globally right now. And then if you look at target 3, which is making sure that there is a reduction in the number of deaths due to non-communicable diseases and promoting mental health. There, when you talk about mental health in the Ugandan setting, with the pandemic, looking at the pandemic now, which has caused a lot of mental distress for so many people, anxiety, unemployment. So we have a surge in mental health cases, but also looking at the situation in Uganda, we only have one national mental referral hospital. And yet we have so many people with mental health illnesses, and we have a lot of stigma currently. So there's a lot of work to be done to achieve that particular target too.
But with the outbreak of COVID-19, both government and members of the civil society agree that the impact on implementation will likely stretch the progress of countries like Uganda.
There's a lot of cases of teenage pregnancy, there's a lot of cases of child marriages, a lot of cases of sexual abuse. How are we going to support those children to make sure that they get back to school and continue with their education? Otherwise, like most people are predicting, we are likely to lose a full generation, and that will have a generational effect on our country.
When you look at the performance, we did not achieve 100% of the indicators, and I told you at average. There are some goals we did very well. We are above average, not 100%, but on track to achieve them if we continue with the same stability and with no COVID. And there are others where we're a bit stagnant because of the pandemic, and one of them is health.
The SDGs are taken alongside Agenda 2030, which seeks to eradicate poverty in all its forms and dimensions, including extreme poverty, as it's the greatest global challenge and an indispensable requirement for sustainable development.
It's a matter of now collecting information, and then we analyze that particular indicator concerning child mortality rates, and where we find it's lacking, then we share with the sector concerned. And the good news is that some of the United Nations agencies, development partners who participate in the reviews and we discuss with them, they support that initiative. And for the case of poverty, of course, there was still a bit a problem, poverty levels being high in some areas because of COVID. But against all odds, of course, the government is starting up this program of parish development model to make sure that all the resources reach the farthest possible people.
However, Owekmeno says the achievement of the global goals will be determined by how countries work in solidarity with their populations.
We have 9 years to go. As a country, we should reflect on the critical goals and also the critical indicators that we must work on and make sure that within these 9 years, at least we have 85 scores on each one of those. And for me, the first goal is on health and well-being. We have a young population, and we are having majority of them dropping out of the development cadres because of sexual reproductive health issues. We must prioritize that and make sure a bigger proportion of our young people are able to grow and move to the next level and contribute productively to our country. And that relates to goal 4, that we need to make sure that we keep our children in school. If we are able to get about 85% of our young people by the next 9 years, 85% of our young people who enroll in P1 get up to the university and graduate, that's when we will have a critical mass of citizens who can work to transform this country and take it to the next level. And then lastly is the issues around gender equality.
Walter Mwesigye, NTV.
National Medical Stores, NMS, passionate about your life, with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities in Uganda.